Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. Angela, welcome to Here for Good, the Inside Edition. We have a lot to talk about, but let's start with maybe a year ago when you took part in opening the Women's Center at Willingboro.
When I came to Virtua about 2 years ago, I was working for VMG North, and we decided to extend the services a little bit more into the community. So we decided to open an office in Willingboro, and it's an offshoot of the Center for Women in Voorhees. And it just brings the services more to where the people are.
So you get a lot of women that are coming in?
Yes, and everyone who comes, they haven't been to an OB-GYN in 5-10 years. But now that it's in the community, they're excited to come.
Obviously, there are a lot of patients that may have not, sought out the types of services that you provide in quite some time. What does that look like for you? Are all your patients the same? Do you have a variety of patients?
As an obstetrician, GYN, I see patients, women in all age ranges. So I have teenagers, I have middle age, menopause age, pregnant, obviously, and postmenopausal. That's what keeps it exciting.
You have a tremendous amount of experience providing care in the community. Not always with Virtua. I know you joined Virtua about 2 years ago.
Correct.
Where were you before that?
I was in the DC area. I had my own practice for 18 years.
So you went from being in private practice to working for Virtua. What's been the biggest difference?
I think I've been able to really dig in more with the patients. Just as far as when I was running my own practice, I was everything. I was running a business, so had to worry about my supply chain, my staff, human resources. I mean, it was a small practice, but, patient care, of course, was the primary thing. But in the back of my mind, I knew I was worried about numbers. I was worried about the money that was coming in. There's just so many other things.
One of the things you feel is vital is patient education or just health literacy for patients. Why is that so important, particularly in the population that you treat?
For obstetrics and gynecology, we're in sort of a crisis right now. There's a maternal health crisis, particularly with African American women. We are 3 times more likely to die during childbirth. There's lots of medical problems that come into pregnancy and are revealed during pregnancy care, again, because patients don't get routine care. So when they get pregnant and they come to the doctor for the first time, we're diagnosing diabetes, thyroid disease, hypertension. That's often advanced because it hasn't been taken care of.
So what can a patient do to be better informed about their health?
Just trying to get patients to engage in their health before they get pregnant would be ideal. And just getting that message out to everyone that coming into a pregnancy in your best state of health is going to be better for your outcome. So you want to be getting routine care. And I find that in the population that I serve, patients don't come for regular routine visits. They come when there's a problem.
Does that speak to the issue we have with health disparities or health equity? Because there are certain populations that we see, even in our very own community, that have access to care more so than others?
Absolutely. And I think it's a trust issue. I think historically, there's a lot of distrust in the health system when it comes to African Americans. And so they're a little reluctant to get care.
Are we finding that in other segments of the population as well?
Patients are best served when they have a doctor who can relate to their experiences. So be it a female doctor versus a male doctor, be it someone of the same ethnicity, because then you can have conversations at a more core level. And you can relate better, and you're going to take the advice better. You're going to trust better.
I know you have been very active in trying and passionate about being a resource for women going through menopause. I find men have difficulties even talking about it or saying the word, so I'm probably just going to step all over my own toes here. But can you enlighten me?
Yes.
What that is like?
It's something that, in the past, people just didn't talk about. Like, my mom didn't talk to me about menopause. It's just not something that people spoke on. And I think it's something now that the newer generation, they want to know what's going on. They want to talk about it, and they want to be prepared for when their time comes. So I'm kind of in a dilemma right now. So when patients come in now who are older, they don't even know what they're going through. They're just like, yeah, something's wrong. So we have to talk about menopause is normal. The symptoms you're describing are normal. You're not crazy, and there are ways that we can help you.
Is there a similar type situation that men go through?
I think so. I call it menopause.
And you look at me as you say that.
I think that the physical changes are a little bit different, though. I mean, for women, menopause, it's their period stops. It's a something that is noticeably different. But for men, I don't think there's such a physical thing. It doesn't have the same stigma associated with it.
One of the other things I know you're passionate about is medical missions.
Yes.
And doing work and going to places that many of the individuals may not get care outside of what you and some of your colleagues bring to them. Share with me a little bit about why you're so passionate about that and perhaps some of the experiences that you had.
Mhm. So I started doing medical mission work maybe about 10 years ago. So I went to Haiti, Jacmel, Haiti, and it was just life-changing. I mean, I've never, ever seen poverty of that level, and I've never been anywhere where there was just no health care. I mean, there was just no one there to take care of patients. So when we arrived, I saw this clinic, it was very interesting. But there were all these people waiting, and I said, "Who are all those people?" And they said, "They're here to see you."
Right.
I said, "Wow," because they hadn't had a gynecologist there.
And many had never even seen a guy.
Most had never seen a doctor. Pre-COVID was the last time that we went. We had built a pseudo-ambulatory surgery center, and we were doing small procedures on patients, actually big procedures. We were doing hysterectomies on patients.
Well, I don't know if you know, but there's an entire community here at Virtua that participate in multiple medical missions all around the world and doing some of the very same things that you had a chance to do with your other organization. So hopefully you'll get connected with that group.
Yes, I've connected with them, and I know they're going next week.
You sound like you're a person that's not afraid of a challenge.
No.
And I know that there are a couple of other things that you like to do that sort of blows my mind a little bit. Is one, your love of running and running marathons and triathlons. What in the world got you sort of drawn into running your first marathon?
So the first one, I ran the Disney Marathon. I wasn't a runner at this point. I got this double stroller and I start running with the kids. They love it. They're upset, they're crying, they're hungry. I'm like, we're going for a run. So that stroller got a lot of work. And it's kind of hard pushing one of those.
Trust me, I've tried it once.
Yes, one of those double strollers in the hills of Loudoun County, Virginia, which is very hilly. And I was kind of like, oh, I like this. And it just kind of morphed from there. Then I started just running more, going out on my own. And I would start running, and it was just the time when it was peaceful. I didn't have a pager. I didn't have a cell phone. Like, no one was bothering me.
So you went from running, and then a triathlon involves other
Yes,
activities. Were
yes.
you a swimmer also?
No. So I ran a marathon in New Orleans one year, and then I broke my leg. And everything came to a hard stop. I mean, I had an open fracture. It was terrible. And they said, you might not be able to run anymore. And I said, oh boy. Running gives you a lot of endorphins. I think it was kind of my just mental therapy, my healthy space, my safe place. So when I couldn't run, I got kind of depressed. And part of the therapy was water therapy. So I'm in the pool walking, and that was the only time my leg felt good. And so my therapist said, well, you should swim. And I'm like, I don't know how to swim. I'm from Brooklyn, New York. We didn't grow up swimming. 45.
And you didn't know how to swim at
No.
45. That's a whole nother podcast, but
No,
go on.
didn't know how to swim. So I learned how to swim, and I liked it. And then some friends of mine were like, well, get a bike, and then you can learn to do triathlons.
So you went from marathons, triathlons, and then at some point you decided you wanted to start mountain climbing?
Well, yeah.
So there's sort of a theme here.
Yeah, the main theme is I love the outdoors. I love nature, and I find solitude in just beautiful surroundings and sceneries. My last mission trip, I went to Zambia, Africa, about a year ago. And I got to see Victoria Falls. It was beautiful.
Yeah.
It was beautiful. And as I was flying out, we went over these mountains. And I said, what is that? They said, that's Kilimanjaro. And I said, oh, do people climb that? They said, yes. I said, all right. So I had a new mission. So I got some of my Ironman friends with me, and we decided to train and attempt to climb Mount Kilimanjaro.
You said attempt, so did you not make it to the peak?
We did not. It's 19,000 feet.
Uh-huh.
We got to 16,000, and they had an unprecedented storm. This was the time of year. It's not supposed to have these storms, and they had an ice storm, and we were forced to turn around.
Any thoughts of returning to?
Oh, yeah, I'm going back. It's booked. It's booked. I'm going back in August.
One of the things that we run into these days, a lot of our clinicians are dealing with burnout. We try and encourage physicians like yourself to find outlets that help them to recharge, refuel. So is this your way of sort of maintaining your own sanity, is through your outdoor adventures?
Absolutely. I can be home and say I'm going to relax and read a book or something, but I'm like, oh, I should look at charts. I should go over results. I should prep for the week. It's hard for me to turn off. So if I'm in the mountains of Africa with no internet, it becomes real easy. You have to be just dedicated. You have to want to get it done and willing to try.
We are so fortunate to have you. So thank you for joining me on Here for Good, the Inside Edition.
Thank you. It's been a pleasure.
Well, what a wonderful story. I actually felt like I need to go out and do something physical. But please join in next time for one of our many exciting stories that are shared with our wonderful colleagues.